Hi, New Beauty followers. We are back again with another New Beauty Talks. I'm features editor Tatiana Bito, and today we're talking about lasers, which I'm really excited about. Dr. Joel Cohen, he's a Denver, Colorado dermatologist, will be joining us, and he's definitely the person to talk to because he's a leading expert in lasers. I've always wanted to have a laser and I've never gotten one, so I'm really excited about today's conversation. Also, I just wanted to remind you that our fall issue is out with Kristen Bell on the cover. If you haven't gotten it yet or read it, pick it up. It's brand new, and there's so much good stuff in here for fall. So let me patch Dr. Cohen in really quickly and we can get started. I know everybody has questions about lasers, so please drop them into the little comment box and we will answer them for you today. Let me just add him. It is not wanting me. There we go. He should be joining us in 1 second. Let me give it a second. Hi, Dr. Cohen. How are you?
Hi, Tatiana. How are you? Nice to
good.
see you.
You so good to see you. I miss seeing you at ASDS this year. I miss our conferences that we get to attend.
Sam, this is tough stuff. I can't believe you've never had a laser. Is that what I just heard?
I've never had a laser, and I really want to get a laser because I just turned 43 and everything is showing up. So
honestly, you look great. So
thank you.
I don't think you need a laser, but you know, there's disease dermatology and desire dermatology. And from a desire standpoint, you want to do a laser, we can certainly do that.
You're so sweet. So can you tell our followers a little bit about yourself who may not be familiar with you?
Sure. So I practice in metropolitan Denver, Colorado. I did a fellowship in aesthetics as well as Mohs surgery. So that's really the core of my practice. And we do a lot of clinical trials at my office, and really lasers is one of the areas that I spend most of my time doing. So it's exciting being a part of clinical trials and new innovations in lasers and technology. And it's even more exciting to use these things together to give people great results.
Yeah, you're definitely the guy to talk to. So, and I hope everyone who's watching gets that. There's a lot of people out there who are experts in a lot of things, but Dr. Cohen really does specialize in lasers, and he's like top of the list for who you want to talk to if you need information. He's also on our brain trust. So thank you for that. And who is a good candidate for a laser?
You know, honestly, I think people need to realize that there's different targets for lasers. So, you know, people use the term chromophore and just replace that with target. So if you're looking at your skin and you're seeing areas of splotchy pigmentation, then pigment is one target. If you're looking at your skin and see redness and rosacea and blood vessels, then that redness is another target. And finally, if you're looking and really critically in the mirror and you see etched lines and wrinkles, then that's a resurfacing laser. So really, those are the three main categories of lasers. And then a lot of these other energy-based devices are focused on other issues, such as, you know, like radio frequency and those types of devices.
Yeah, I think when we say laser, it sounds like this broad umbrella, and there's just, you know, it really is depending on what devices your doctor has and what your need is. So I'm glad you can clear some of this up for us. And what's the difference between the stronger lasers, the ablative lasers, and the non-ablative lasers?
So, fantastic question. So, you know, ablative basically means that there's a wound. So there is a wound healing response. So typically those lasers will have downtime. So lasers that I use every day that are really ablative lasers are designed for etched lines and wrinkles around the mouth, around the eyes, on the secondary smile lines. And it's very common for me to use fractional CO2 and full field erbium, or full field erbium plus fractional erbium. And we use these things a little bit differently depending on what the goal is and what we're adding to the skin with the laser treatments, which is a pretty exciting area. So this concept of laser assisted drug delivery is something that we use for ablative lasers. You can topically apply like platelet rich plasma, PRP, on the skin to try to facilitate the healing process, try to give people even a better response. You can topically apply things like Sculptra over a laser, and it seems with fractional erbium that it gets into the little columns that are delivered a little bit better. than it does with fractional CO2 because CO2 has more coagulation of those little columns. But that concept is really, really blossoming in non-ablative lasers. So, you know, there are lasers that are fractional lasers that poke holes in the skin, and you and I and NewBeauty have worked on some projects using, you know, for instance, the thulium laser, which is a laser that really is devised for pigment and sun damage, and really no significant pain, no major downtime. It's like 2 days of being pink. But there's one specifically, the Lutronic Ultra, where you can order these ampules that are actually designed to go below the surface of the skin and help whatever the issue is. So one of the common ampules that we use is actually tranexamic acid. And if somebody has melasma or pigment, then by virtue of just using the laser, this is non-ablative, so there's no wound, you're poking holes into the skin, and you're using that energy, which is a wavelength of 1927. And it's interesting, you can see a great result for pigment from that laser alone. You can see an added benefit by that laser-assisted drug delivery and topical application of something that really goes into those channels. And you can't use just anything topically, I might add, because you know, you really have to realize that some creams and lotions and things like that were designed to go on the surface of the skin and were not designed to penetrate the skin. And it could actually be some issue in terms of eliciting sort of a sensitivity or an allergy to products. We call it a granuloma. So it's unique to have a formulation that you can actually use, which is really designed to work underneath the skin. And that's really how we use the tranexamic acid ampules to deliver it. So we're seeing really nice results with pigment and melasma. And that specific laser is interesting because it was also cleared by the FDA for precancers, actinic keratoses. So, you know, some of our patients come in and say, well, you know, I'm really not liking the fact that I had so much sun over the years, and people always comment on my blotchy pigmentation, but I don't know if I really want to spend the money and do something cosmetic. Do you have something that, you know, has a medical benefit to it? And this is really that sweet spot where this laser is for pigment and sun damage, but it's also FDA cleared for precancers.
Can you repeat the name of that device again, that laser?
Sure. So it's the thulium laser, and its wavelength is 1927. There's a couple lasers out there. The more powerful lasers that really deliver really appropriate energy for the treatment would be the Lace Ultra from Lutronic and the Cyton Moxie. Those are both 1927 lasers.
Okay, so we're talking about the 1927s are the more heavy duty ones?
Those are the lighter ones. So
the lighter
non-ablative. You know,
okay, non-ablative.
So it feels like, you know, it's a grade 2 out of 10 in terms of discomfort, very minimal discomfort, and you're pink for like 2 days, and you do have the option of, you know, adding things to give a synergistic treatment in terms of pigment, like the tranexamic ampules.
So you're talking about having the laser treatment, and then while you're having the laser treatment, or in conjunction, combining it with a topical that will be absorbed better into the skin because the laser is opening those channels, right?
Exactly. So really, you know, when people first started thinking about like microneedling, and we've covered this in NewBeauty a few times, the whole concept of microneedling and delivering channels. I did a Vogue.com article on microneedling as well. You know, it's really interesting to realize that, you know, there are ways to put holes into the skin with little columns to sort of stimulate collagen, and then there's ways to actually use the holes that you push into the skin to stimulate collagen with energy. So you can do those fractional microneedling type things you can do with laser. You can also do it with radio frequency. So radio frequency is something that we use for instance, laxity. So we call these the secondary smile lines or accordion lines. And, you know, by virtue of smiling like you and I just did, you know, over time, you can see mechanically those
really
areas.
Deep there.
Those contract. There's been some studies looking at that. It's more common to have more pronounced little areas of change on the left side of your face, usually from driving. And there are some studies actually showing that we see more skin cancer on the left side of our face, from driving as well. So that goes hand in hand. So, honestly, the radio frequency microneedling devices that poke holes into the skin and use radio frequency, which is energy. So if you think of a battery has a positive charge and a negative charge, and those communicate. So that's essentially what this is doing. You're using that positive and negative charge to induce heat. So, some of the really popular and common radio frequency microneedling devices are, first of all, the Lutronic has the Genius RF, and InMode has the Morpheus. And those are great treatments. You have an insulated needle. So when it goes into the skin, whatever's left towards the surface is actually insulated to protect the epidermis, so that you can use it on patients who have darker skin types, type 4, 5, and 6, which would be Asian skin, East Indian skin, or African American skin.
We're getting some questions in. We have one. O Spatafor says, is there any downtime to consider from the 1927 laser treatment?
As I said, it's usually you're pink for about 2 days. You can certainly turn the energy down. So when we're treating patients with melasma, a lot of times we'll use a milder setting. So either less heat, in terms of power, or less passes. So you can modulate that. And in some cases, you can modulate it down to the fact that, somebody may look a little bit pink for maybe, 6 or 8 hours. And you can, by the same token, go up in the number of passes or the energy, and you could give people a little bit more than that 2 days of looking a little bit pink and a little bit dry, and you could go up to maybe 3 days or 4 days. But I think in general, I always shoot for that sweet spot of telling patients it's probably a day or two they're going to look slightly pink and be a little bit dry, but it's really well worth it. And we don't consider this a downtime laser at all.
Yeah, 2 days is nothing if you consider how long, like I, for instance, have the melasma mustache, and it's, I cannot get rid of it. And it's been months and months. So I'll take 2 days of pinkness just to get rid of the extra work I have to do to cover it up all the time.
Tatiana, I can't see it, and I actually look at it all the time. So you're either it's pretty mild or you cover it up really well. But let's talk about melasma. I think if you poll every dermatologist out there, worldwide, and say, what do you want your epitaph to say on your tombstone? It'd be great mother or father or friend or parent or whatever. And as far as professionally, I think we'd all like it to say like cured melasma or something like that. And honestly, the hardest part about melasma is it's so patient dependent. A patient needs to absolutely be a co-participant in their care. So I can have you come to the office and do all kinds of treatments, but if ultimately you don't go home and use sunscreen with the right ingredients for outdoor light, as well as use sunscreen with the right ingredients for indoor light and screen light, like we're on right now, for instance, blue light, then it's not going to be helpful. So we know that people who are on sometimes oral contraceptives or who are pregnant have a kick up of their overall hormonal level. And sometimes patients just have that without even oral contraceptives or being pregnant. And that hormonal level allows the pigment producing cells in very specific sun exposed areas, like you indicated the upper lip, like the cheeks, or like the forehead are the most common areas, those bony projections where you do get a lot of sun. Those people do have more pigment production in that area. So melasma can be really difficult to treat. And, as a first step, it's use sunscreen with zinc and titanium for outdoor exposure, but, rub it in well, because you want to use something that you're going to use. Number 2 is you have to reapply it every hour and a half or 2 hours. If you don't reapply it, it's not effective any longer. And number 3 is, indoors, you actually have to use sunscreen because there's data on blue light. There's data on other visible light and fluorescent light. And one of the things to really keep in mind is that with all the video conferences during COVID and all the time we spend on screen time anyway, there is data about blue light stimulating pigment. And one of the specific ingredients to look for that can actually filter out blue light in sunscreen is something called iron oxide. So if you have zinc and titanium, that actually, if it's rubbed in really well, no longer prevents really blue light exposure. So oftentimes it's different depending on if you're outside or if you're inside.
We have another question here, and thank you for that. I don't want to hog the floor with my melasma questions. We have another question by Exomat. Are lasers good for under eye puffiness?
So, you know, we talked about melasma being a big issue. Under eye issues are probably the second issue where all of us dermatologists and aesthetic dermatologists and plastic surgeons, you know, honestly, you just sort of, you know, it's frustrating. So under eye has so many different issues, and one of those areas is really overall puffiness. So, you know, if it's puffiness with a fat pad that comes with it, then actually that is called festooning, and those fat pad areas can be improved by using some lasers. So if you use like the ablative lasers, the ones that have a wound that takes about a week or week and a half to heal, you can see improvement of that. But, you know, I would see your doctor and have that evaluated. There can be medical conditions that are associated with under eye puffiness, and you just want to make sure that everything from a medical perspective is okay. You know, sometimes people have edema, you know, in that area, and it could actually be due to, you know, some swelling phenomena that they have in their face. It could be due to, you know, a lot of issues that we see as dermatologists related to sun exposure or autoimmune problems, or even allergies for things that people put on. So it's probably best to have an overall assessment by a dermatologist before you go pursue cosmetic treatment. But under the eye has a lot of issues aside from just puffiness. As I said before, a lot of people have etched wrinkles. We try to treat with resurfacing. Some people really just have volume loss, where we use some fillers with a cannula to try to lift up some of the area. And honestly, you know, the topicals are not great for the under eye area. We really need to think about some of these energy-based devices and some of these procedures.
Yeah, I think the focus on our eyes is so much more now because we're covering up with masks. So whatever we can do to sort of clear up that area, I say go for it. You got a shout out by Dr. Paul Jared Frank. He says all about the Fraxel technology, the gold standard. Hi, Dr. Frank. And what about for acne and acne scars? What do you recommend?
Paul's my bro. We're on a text chain every day for years, and you know, so it's good to chat with Paul. He's probably busy with patients right now, but you know, there are a lot of different technologies in the Fraxel, you know, type of family, and fractional resurfacing is really, there's non-ablative, as we talked about, and ablative, and then there's other devices that work fractionally using those little columns where you can put different energy in. And I think, you know, when we complement and use different things in combination, it's a winning formula. So it's very common in my practice for me to take somebody who doesn't want downtime and, for instance, use the thulium laser, like the Lace Ultra, at the same time as the Genius device. They're both fractional devices. They both poke holes in the skin. One is delivering a wavelength, 1927, and the other one is delivering radio frequency. And you can see improvement in pigment from the thulium, improvement in overall skin smoothness and quality without downtime, as I said, pink maybe for a day or two, and then use the radio frequency where you're also red, you know, a bit for a couple days, and you're actually penetrating deeper, protecting the surface of the skin and helping some of the laxity here, or laxity along the neck. So I totally agree. I think, you know, all of this area of fractional technology is really exciting, and we're even going to see more on that. So when it comes to, as you indicated, acne scars, we also use the same type of fractional technologies because, again, you're poking holes into the skin with fractional columns, and you can add energy to that. The non-ablative lasers like the thulium or the 1540 from, you know, Cynosure is a great laser to use. Again, no significant downtime. And then you can use the radio frequency, which is still on par with a couple days. And it's common for us to do that kind of combination on the same day. But when people want to see major improvement in their acne scars and they have significant or disfiguring acne scars, they really do need to plan on doing, in addition to the things we just mentioned, the non-ablative fractional and the radio frequency microneedling, absolutely they need to do fractional ablative resurfacing with fractional CO2 or fractional erbium. That does take about a week to heal. If you do it with a heavier hand and they have more time, then maybe 10 days to heal. And on the same day, I typically do something called subcision, where you're actually taking this little needle that has a blade at the end, and you're kind of freeing up the areas that are sort of pulled down from some of that scarring. And that complement can work really, really well.
That's so interesting, because that's typically you do that for cellulite, right?
So cellulite is a very, very exciting area. And that's really where a lot of subcision came from. So there's a dermatologist from South America. Her name is Doris Hexel, and she really pioneered a lot of what we do with what's called subcision, using that little needle with the blade at the end of it. And, you know, the cellulite area is an area where if you take a dimpled cellulite and you free that area up, if you think of like an old-fashioned couch that has those little buttons on it, all you're doing is releasing that button, and it'll come up a bit. It may not come up all the way adjacent, you know, to be similar to the skin, but it's going to come up a bit. And that's what we do with cellulite. So I have the Selfina device, and that's exactly how it works. You're releasing the area. But I'm excited that there's going to be an injectable for cellulite called Quo. And I did the clinical trials for Quo, and I actually just led the educational initiative as chair to really sort of plan the rollout for cellulite in terms of Quo. And you're injecting this enzyme, which is collagenase, specifically at those little areas that pull down. So you don't have to release it with subcision or the other device. You can actually inject this ingredient called collagenase that you're actually helping to degrade that area. But I think it's exciting that there's other areas of cellulite where people don't just have dimples that are pulling down. They have areas of waviness, or what we call laxity. And there's a lot of new emphasis on that. And the same radio frequency devices that we've talked about, fractional radio frequency, are really, really exciting for cellulite as well. And the studies are going on right now. Plus, you can use dilute radiesse, the filler, and reconstitute that so that you can actually put it into the areas of waviness. In some of the, you know, you have peaks and then you have naders. And if you sort of thread it in to the nadir, you can stimulate some collagen and make it all sort of globally improve. So that's a great area where we're combining injectables in future like Quo to injectables now for waviness like dilute radiesse to devices like the fractional microneedling, Genius, and Morpheus.
I think it's so neat that we're getting that injectable for cellulite. We've been waiting for it. So I can't wait for that to come out. But also, I think you make a great point across the board when you're going to see an expert, a doctor, a board certified dermatologist. It's not just, I'm here for a laser. The treatments are usually stacked and in combination so you can get the best results. So I think people should be more aware of that. Can you speak on that a little bit? How do you know when someone's going to need 2 or 3 things to get the result that you want?
You know, honestly, there's this month in the journal Dermatologic Surgery, there was a release, it was published ahead of print, of a cellulite type of scale that physicians can use and patients can use. So I was the lead author of the paper. It's open access. You can go online. And I did the project with Neil Sadik from New York and Mitch Goldman from San Diego. And I think if you look at that scale, you'll see that there are different degrees of scale of cellulite. So some people have, you know, very mild dimples, and some people have more prominent dimples in terms of size or depth or number. And that's really important to keep in mind as a cellulite scale. And patients can use that scale too to really look at themselves and say, you know, where do I fit in this overall scale? In general, you know, if you have a lot of dimples and they're deeper dimples, then we tend to use and plan on using a combination of a few things. So, you know, right now you can release it with Selfina, or you can do subcision. But going forward, you'll probably do that in combination when Quo becomes available sort of early, you know, probably second quarter next year. You know, we'll hear more about that. So, you know, in addition, if you have laxity and you have that waviness type of cellulite, then you can probably bank on using some energy-based devices like the radio frequency devices. And there are some other devices using either ultrasound or acoustic waves to actually help cellulite too. So I think that my one prediction for 2021, by next summer, we're going to actually be seeing a lot of interesting innovations on the market for cellulite. And by sort of third and fourth quarter, we're going to be talking about the ways that we use these in combination and showing before and after pictures of combination cellulite treatment using injections and energy-based devices together.
I can't wait. Actually, we have a cellulite story in the new issue too, so pick it up and you'll read more about it. Let's go back to laser.
I proofread that.
You did.
That. So,
no, you proofread a lot of our stuff to make sure that everything is accurate before we print it.
And I think the online link was actually going to talk a little bit about the cellulite scales. So that may be on there by now too. But that's something helpful where patients can really go to and use as a resource to see what may be beneficial for them to do. And if people, 90% of women actually suffer from cellulite. It is a major issue that we see in our practices that affect the way that people feel when they're wearing, shorts or workout yoga pants, or even, obviously a bathing suit. And
the shirts too, yeah.
And there's definitely help on the horizon, but there are psychosocial studies that this can be very, very distressing for people. And I think, again, 2021 is going to be the year that we have a lot more treatment options for people with cellulite.
Let's go back to the subcision for acne. How do you do that? Do you do it from inside? How do you release the acne scar on the face?
So subcision, when you think about it or hear me describe it, it almost sounds almost barbaric, where you're taking a needle and you've got a blade at the end of it. But actually, it's a very gentle and precise procedure. So typically, I will do it on a day where somebody comes in for resurfacing, where somebody actually, I look at them and we're planning on doing heavy resurfacing with an ablative technology. So again, ablative means a wound. So there's vaporization of the tissue, and it's going to take about a week to heal. You could do it a little lighter. It might be 4 or 5 days. You can do it a little heavier. It may be 8 to 10 days. But in general, it's about a week to heal. So if you're incorporating the subcision, basically you're going, adjacent. You have an area where there is a depression in the skin, and you're coming at it with the subcision needle, and then you use the blade to sort of free it up. It's almost like a windshield wiper right underneath it, and you're taking that band that pulls down and you're just allowing it to lift up. And it's great to do that at the same time as laser, because that little insertion can take about a week to heal from a swelling or a bruising perspective. So they're really similar in terms of time.
That's great. And I think for people who have been living with acne scars for a long time, it's definitely worth the, slight pain and healing, associated with this treatment. Okay, I have another question from Danielle. Do you have a go-to entry-level laser you'd recommend for a first-timer?
Honestly, the non-ablative fractionals that we just talked about are great lasers to do for first time. So, let's take the thulium laser, the Lace Ultra or the Cyton Moxie. Those lasers are very, very minimal discomfort. So whether you use some topical anesthetic or not, if you do use some topical anesthetic ahead of time, it's probably a 2 out of 10. If you get to the cheekbone, it may be a 3 out of 10. And I have these treatments done just so I know what they're going to feel like. And I tend to do these treatments, not that I'm tough, I tend to do these treatments without anesthetic or without anesthetic on the appropriate amount of time, simply because I do it at the end of the day when I'm done seeing patients, oftentimes on a Friday, and I can't walk around with topical anesthetic on, for 40 minutes before that. So I get a sense of how things feel. But believe me, I am not tough. Ask my wife. I'm a wimp. And the non-ablative fractional lasers are really mild discomfort, and you can modulate. So again, it's a day of being pink or maybe 2 days of being pink. But that's a great place to start because it really works on so many endpoints. It can work on sun damage. It can work on acne scars. It can work on smoothness to the skin. It works on light reflection to the skin. So overall, you're going to look like your skin has more luminosity to it. So I think that's probably a really nice sweet spot to start for a first-time laser.
And then when should you do it again? Should this be a yearly or every 6 months treatment to maintain results?
It really depends on how much sun damage somebody has. If somebody comes in and they're 50 or 60 years old. They have a lot of pigment. They have a lot of roughness to the skin, but they don't have a lot of lines and wrinkles. Then I would really recommend, typically they'll do a series of something like the thulium laser. They'll do a series of maybe 3, and then, and then we can address something else. If they have etched lines and wrinkles that are really significant, and that's their predominant concern, they look in the mirror and say, gosh, Joel, I look at myself and I have such severe etched lines. I would start with an ablative laser that has downtime. And by virtue of treating the etched lines and wrinkles, you're going to actually treat some of the pigment. I tend to do a pigment laser just before that on the same day anyway. And then we can address whatever's left over in terms of pigment. So, the severity really matters as much as sort of the downtime and the expectations and the finances of things as well. But the thulium is a really nice maintenance laser. When people have a lot of pigment, I tend to do halo plus BBL. So for people who don't have a lot of etched lines and wrinkles, but they want to see major improvement in pigment with less treatments, maybe one treatment, because, honestly, there are times where, somebody comes in. I had somebody last year, and I've given these photos to Saitan and presented them. Somebody came in early December last year, and they wanted to make their pigment look a whole, like a different patient by really Christmas time. So we had a window of about 3 weeks, and we accomplished that. And I'll post that on my Instagram in the next few days because I'm mentioning it. But, if you do a combination of pigment lasers and something like Halo, which is a hybrid fractional on the same day, you have a 4 or 5 days of a sunburn. It's not heavy downtime. It's a sunburn. So if you think of the movie The Hangover and the dude that fell asleep on the roof, that's what we're talking about. They're going to look like they had a sunburn. It's not bad. It's definitely a little bit redder than the thulium, but not bad at all. And I think Saitan Halo, the hybrid fractional, is a great one. I published an article using a combination of non-ablative and ablative, which led to the Halo with Vic Ross several years ago. And really, we can, by combining those two wavelengths, you can decrease downtime of having the ablative fractional just by doing it at the same time. So 4 or 5 days with a Halo, and it's really a great laser. You're going to see improvement in pigment, smoothness, and pores for sure. And any pore improvement is temporary. So you need to use a topical retinoid long-term in conjunction with that. And there are other options for pores you can do as well.
Danielle says, sign me up. Sold.
So tell her to come to Colorado. You should come too.
I know.
Whatever's underneath there, we'll treat as soon as this craziness is over.
As soon as I can get on a plane, I'm coming straight to you. Okay, so CEO Matt says, can lasers be used on spider veins?
So, honestly, lasers for spider veins is something that you can do. And I think that, there's always been sort of the principle that sclerotherapy seems to work better and more predictable for spider veins. So, sclerotherapy involves taking an injection with a very tiny needle, getting into the blood vessel. And when you're squirting in the substances like polydocanol or sotradecol or sodium chloride, when you're doing that, you're actually inserting it, but you're going to the whole area that the spider veins go to. The laser is really only working very focally, and sometimes when you're one little spot is to those little spider veins. So what happens is that you can see improvement in that one area, but you don't see improvement in the global area like sclerotherapy, and then that area that was treated by the laser can sometimes refill. So, we can use lasers in combination for spider veins. Sclerotherapy is more ideal, and then sclerotherapy sometimes with the addition of some laser for like some of the areas we call matting can be helpful.
Okay, Exo Chaz says, we're in Colorado, and you are in the Denver metropolitan area, correct?
Yeah. Yes, okay. So Greenwood Village and Lone Tree.
So let's get off the face for a minute. What other areas of the body can you have lasered? So, I know the chest and the neck are a popular spot.
So let's talk neck, chest, and then hands. Okay. So honestly, as a person who spends a good deal of my time doing lasers and working with sun damage and then doing a lot of skin cancer surgery on the face, I think we get our patients to finally realize that they need to be good about sun protection on the face, right? But not everybody remembers to use sun protection on the neck and chest. And I think, some of that is that feeling of like, okay, I can put it on my face because I found an elegant formula that I like, but I just don't want to use it down here because I don't want it to get on my shirt collar or my clothes, or, I don't want to reapply all over during the course of the day. So we typically start to see a disconnect between the face and the neck and chest in the late 40s. Now, some of that probably is related to some perimenopausal symptoms and some decline in estrogen. And there has been some studies that within the first 5 years of menopause, people lose 30% of their collagen. So think about it, the face, the neck, and the chest is going to show that more because you're already losing collagen from sun damage and the turnover of those enzymes. So we can use energy-based devices and lasers on the neck and the chest. We use different settings. In some cases we use different overall technologies, but we can use things like the thulium laser for pigment. There's on the neck and the chest, we can use radio frequency for some of the laxity on the neck and chest. There is the area where you're actually sagging, where people develop sort of laxity on the jawline. Is that face or is it neck? It's kind of both. So we actually treat that in complement. And therapy can be a fantastic treatment for sort of that laxity because you're using microfocused ultrasound to really induce heat and use that energy to lead to some tissue lifting and contraction in this area and down here. It's not reliable like surgery. You can't look at somebody and say, you're going to have this much improvement because it just doesn't work that way. But for people who don't want to have surgery, don't want the downtime of surgery or potentially the anesthetic of surgery or other risks, therapy can be a really nice way to remodel this lower face and sort of the neck and the laxity. We use that in combination with radio frequency, the microneedling radio frequency all the time, as well as, an interesting treatment for the lower face and the under chin area is called Evoke. And Evoke, we got in our practice in July. You basically wear like a little helmet device for the lower face, or you wear a little strap for this area here. And the treatment has no discomfort. It takes about 40 minutes, and you do a series of treatments. So there's no downtime, and you help contour. It's probably more working on some of the fat and just contouring the face. But if you look at some of the pictures, you can see the jawline more clearly, and you can see some improvement of this area as well, some of the under chin laxity. And, I like to use it in conjunction under here with like Kybella. So you can do Kybella, for some of the submental fat, and then you can work on some of the laxity and some of this whole area with Evoke or therapy or even both, because the mechanism is different.
So Evoke is radio frequency?
Yes. Mm-hmm. So radio frequency is really exciting right now because there's different ways to deliver that energy. So as I said, there's like the fractional, which is the microneedling with radio frequency, like the Morpheus and the Genius and Fractura and those types of things. And then there's the Evoke, which is a bipolar radio frequency, but there's no fractional component. You're just sort of causing the positive electrode and the negative electrode to create heat, and that heat is causing some lifting and some contouring. So really, because it's radio frequency and it's bipolar, the types of issues, we don't use it if somebody has an implantable electric device, like somebody who has a pacemaker or defibrillator or cochlear implant type thing.
What about for those either dark spots, sunspots on the chest, or the white blotches? Can lasers help clear those up?
Yes. So, lasers can be great for some of the sun damage on the neck and the chest when it's pigmented sun damage. So, and lasers, the lasers we talked about, the thulium or the halo or those types of lasers can be really helpful. When it's redness and something we call poikiloderma, where, the term, if you have a red neck, you've gotten a lot of sun. It typically spares this area underneath here because of the shadow. So you have a red neck here, and you have a red neck and décolleté here. We tend to use like pulse dye lasers. And then some of the other devices can be really helpful, for that as well. So there's certain non-ablative fractional lasers that help with tissue coagulation for that. So, in general, when I see somebody who has pigment and redness, I think the go-to one would be the Halo, the hybrid fractional, because you're using the two wavelengths in there, the 1470 and the 2940, to get some of the redness with coagulation and some of the pigment with the more superficial laser and that sweet spot. But if people don't want a little bit, that 4 or 5 days of downtime, you can do other lasers that don't have any downtime, like pulse dye laser for the redness, and you can do, other things for the pigment areas like BBL or Q-switch laser or some types of more specific IPL devices.
Well, you're headed into sweater weather. I'm not, I'm in Florida, but we're getting into that place where you can hide that stuff if you want to have a treatment before spring and summer. But how long does it take before you can see any kind of results for any of these treatments?
Quickly. So we are definitely in sweater weather. So it was 2 degrees overnight on Monday night here. Oh, no. And we've had already 2 snowstorms and two snow days at school. So Monday, my kids did not have to go to school because of snow. So, wow. I mean, pretty crazy. The roads were really, really slick because during the day, it was 9 degrees. So we are at sweater weather. So sweater weather is good because, you obviously are more sun protected. We see people who are spending time outside and they're hiking in the snow, or early season people are starting to do cross-country skiing and those types of things. And these areas are covered up, which is great. It also means it's a great time to do procedures because A, these areas are covered up, so you're not going to be getting sun afterwards. And B, you can hide any downtime that you have. So sweater weather, and I love that Saturday Night Live skit, is a perfect time to do these treatments, but it doesn't have to be necessarily during sweater weather because a lot of them don't have downtime.
Right. And in Florida, we don't get a sweater period. Like my pumpkins are melting outside. So
come on, 62 degrees for you is chilly. We had 2.
We're still at like 88. So yeah, we're not even close. Well, thank you. Oh, we haven't gotten to the hands yet. So let's talk about the hands. This is such an important topic. And on the last season, this is kind of a reality show thing, but on the last season of Real Housewives of Beverly Hills, one of the characters showed her hands on screen, and it just became this viral thing because her hands didn't match the age of her face. And she's been getting this, reality star's been getting a lot of treatments, but her hands have not. So hands are a big deal. What are you doing for hands?
Well, honestly, that's a great topic of discussion in addition to cellulite, because we did cover hands in the summer issue of New Beauty, and I had a before and after in the lower right corner of a patient that I treated with fillers. So, let me say first that when wearing masks, as we talked about, we're seeing a lot of focus on the eyes and doing rejuvenation around the eyes. We're seeing a lot of focus on the forehead and using treatments in that area, as well as underneath the mask, so the lower neck and the décolleté area. And I think, we've talked about those areas, and people tend to focus on those areas. So if you're outside and you see somebody somewhere and you're talking with them in a parking lot, you're going to focus on what you can see, which are those areas I mentioned. And in addition, people tend to use their hands to explain things. And then all of a sudden you're looking at their hands. And we even do that on video conferencing. So it's not just something that's important from a live meeting perspective or seeing somebody live. It's also as we're doing things, because you can look great here, but then you can look like you have, grandma hands down here. Yeah. So, honestly, that is something where we have a lot of new options to rejuvenate the hands. And, fillers are one. So there is volume loss in the hands, just like there's volume loss in the face. And we use fillers. There's 2 fillers that are FDA cleared for that. The first one was Radiesse, which is sort of a white sort of color to it. So it does a nice job in camouflaging not only the tendons, which seem to be apparent when you lose volume, but also some of the veins that become apparent. So I think Radiesse is a great treatment option. It's not something that's real painful. It lasts about a year. And then Restylane Lift is something that is also FDA cleared for the hands. I did that FDA study, and we have a good idea about how much volume really is required to see improvement based on how severe the volume loss is. But suffice it to say that 1 syringe in each hand, or sometimes a little bit more than one syringe will give people a nice improvement. And there is a scale that was published that I did with a few other people a few years ago in dermatologic surgery about really how to score the hands in terms of how much volume loss you have. So how much tendon show and how much vein show you have. But you can really make the hands look really youthful, and check out the summer issue of NewBeauty for those pictures I mentioned of mine. Secondly, people are concerned about sort of the same brown spots on the hand as they get on the face, because that's an area people commonly forget to put sunscreen, and they get a lot of sun exposure. And when people come into my office, you can tell sometimes who's the golfer and who's not, because one hand will be completely clear of brown spots and the other hand will have a ton of brown spots. And clearly they wear a golfing glove to prevent calluses and things like that. So you're oftentimes just treating one hand, with some of these modalities for pigment. So rough skin is another form of sun damage and texture issues. And, we see that on the face. We can do what's called a micro laser peel with an erbium laser and sort of peel the hands. You see great improvement with 1 or 2 treatments. For people who don't have an erbium peel, some of the same agents that we use on the face can be really effectively used on the hands for peels. So there's a peel called a Gessner's peel that's a really nice peel. The company PCA makes some great peels overall. So see your dermatologist, and they tend to have some really good peels. Then you can really modulate your downtime and your endpoint. But if it's for pigment, then something like Gessner's solution would be really helpful, or a modified Gessner's solution.
It seems like such a superficial thing, the backs of the hands, but if you're spending all of this time to sort of rejuvenate the face, it's, your hands tell on you. So
honestly, so many people that have embraced the face have been hesitant to really embrace the neck, the chest, and the hands, because it's additional money, and they feel like, most people are going to see this, but they forget about, the fact that when this is all over, we're going to be going back to wearing, V-neck clothing in person, and people are going to be wearing gowns and things like that. And, when somebody has like a major event, I have a patient who I was talking to yesterday on the phone who comes from the mountains, but there's 3 kids in the family that are getting married in 2021. And rightly so, she's sort of thinking of a plan, progressively. There's one wedding that's earlier, and then there's one wedding in the summer, and then one wedding in the fall. And, honestly, from a socially distant perspective, we're thinking of, okay, so it's going to be winter for the first one. Let's do some sort of treatment to really make sure the face looks good. And we address the concerns she has in terms of etched lines and some volume loss. And then as it gets to, a second point, maybe we can actually, if things change, and hopefully they will, then she's going to be wearing, different types of gowns and different types of things, as the weather changes, and then we can address some of the neck laxity or some of the chest discoloration and those types of things. So I think we're all hopeful that things are going to get better, and we're sort of planning strategically what we can do now that really people have the downtime versus what we can do later that really makes sense with the time of year and what people are going to be able to do then.
What's a good blanket timeline? Like 6 weeks if you have an event and you're not sure even what you're going to, what treatment you're going to get?
So, honestly, 6 weeks may be adequate if somebody comes in and they're really complaining of pigment. You can probably do, in 6 or 8 weeks, you can probably do a couple pigment specific lasers to really give them improvement, something like Halo or, a couple thulium. But if somebody is really concerned about etched lines and wrinkles and those types of things, then I would say, probably 4 months, because you're not done seeing the full extent of the improvement and the tissue contraction from some of the ablative lasers. Again, that's the wound healing response, usually for a couple of months, and there's been some studies on that. So if you're going to spend the money and do the downtime for an ablative laser, why not see the maximal improvement? And I published an article in Journal of Drugs and Dermatology a few years ago where I showed a lady who was a smoker, heavy etched lines all the way around the mouth. And I did full field erbium resurfacing in combination with fractional ablative resurfacing. And I showed what she looked like at 1 month and what she looked like at 3 months. And at 1 month, her improvement was very impressive. It was 90% improvement in the etched lines and wrinkles. But if you wait till 3 months, then you also actually finish out the improvement, and you see some of the laxity improvement in the tissue contraction of the area. And I feel like, and in my practice, if I do heavy resurfacing and I wait like 3 months, I end up using less fillers for these people, especially in these areas which sometimes can look a little bit full. So, I think the fillers in these areas have gotten a little bit better as well. Mm-hmm. So Restylane Define and Refine specifically were looked at in video studies to have what's called stereophotogrammetry. So whereas you animate and do things, it doesn't tend to bead up and it really looks natural and there's less stretch on the skin. And at least in my experience of basically about 4 months or 3.5 months of using RHA products from Revance, I'm seeing the same type of thing. Like I'll use RHA 3 down here and they really do move nicely when you animate. So, doing laser resurfacing and then, waiting to see the effect for etch lines and wrinkles, using fillers in complement to that, and then maybe using some of the radio frequency or the microfocus ultrasound technologies for the jawline area and the neck seems to be really a great complement. We're using a few different technologies for different issues that really make sense.
We only have a few minutes left, Dr. Cohen, and we have a bunch of questions, so I just want to rattle them off really quickly. Ultherapy for the hands and BBL for Forever Young for the hands. Can you do both or either?
So BBL Forever Young for the hands is a great treatment. BBL really is helpful. So for folks who don't know that, that's broadband light. We tend to use what's called the 515 filter most commonly for pigment, and you can see some really nice improvement in pigment. Different than other IPL devices, that filter is very specific wavelength, whereas other types of devices are sort of different areas split off in different wavelengths, and it's not as precise. So I think that's a sweet spot. We don't use Ultherapy for the hands in my practice. I think Ultherapy is really exciting for jawline contouring, for the area underneath the chin and some of the laxity you see on the neck. It is FDA cleared to give a brow lift. It is FDA cleared in the deco area. The deco area is sometimes more minimal improvement. We can actually address that with dilute fillers. We can do radiofrequency in that area. But I think one of the exciting areas for Ultherapy right now is really for the buttock lifting and for some of the laxity at the elbows and especially the laxity above the knee. And there are some protocols being developed right now that are in the early stages. And some of these results were just published in Journal of Drugs and Dermatology.
They really need to make an Ultherapy machine that you can just walk into, close the door, and then come out. And then you're all tight. One more question. What are the biggest pros of Halo? What does it improve the most? Collagen, texture, sunspots, or wrinkles?
So, I think Halo is all about how you position it. So, you can turn it on low and you can turn it on high. You can modulate the non-ablative 1470 as well as the ablative 2940. But in general, when I do Halo, I do it for people who have pretty significant sun damage and pigment. So they have lentigines, they have rough skin, they have prominent pores. In many cases, they have, some of the oxidized debris in these pores that we call comedones and things like that. So you can actually use Halo plus BBL to give people major results in pigment, in smoothness, in light reflection, and pores, oftentimes with just one treatment. If you do, however, a series of treatments, then you can see more specific improvement, such as acne scars, such as early fine lines. But if you have the Halo, you probably have profractional too, and then you can use the ablative fractional specifically on areas of scars, acne scars, or etched lines, and probably even a little full field erbium on some of these etched lines as well.
And that same person, Java Queen 2, says, is it safe for olive skin tones with melasma? What is the risk of pigmentation worsening?
So my most common laser for melasma is really the thulium laser, the 1927 laser. It is a non-ablative laser, as we talked about. And with any melasma device that induces heat, you want to go very, very light on the heat. So we tend to use lower settings. We tend to do less passes. And we tend to add laser-assisted drug delivery, like the tranexamic acid ampules from Lutronic. So I think those types of things are important. We need to realize that melasma, again, is something that is caused by light exposure, that's sort of revving up the pigment that is really hormonally charged. So sunlight versus indoor light and blue light versus other things where, there's been some studies looking specifically at heat. So if somebody's a professional chef and they suffer from melasma, that actually may be a big culprit. It's just sitting over the stove in a restaurant cooking, for hours and hours every night. So, we have to think about all the different issues. I think, some people who have melasma that are hot yoga people, that may be contributing as well. And we really come with some strategies to help them deal with things, as well as some of the treatments like the laser assisted drug delivery with the thulium laser.
Well, that's it for our, thank you so much, Dr. Cohen. That's it for our questions. You've done an amazing job explaining all of this to everyone. And now I want to laser even more. So
come to Denver.
I'll see you soon. And I'm bringing the entire edit team with me. We're all and everyone, don't forget to pick up our fall issue. We have a lot of skincare tips in here, the latest, greatest on just about everything, including lasers. And thank you again, Dr. Cohen. It's been very enlightening, and we hope to have you on again. Thank you so much.
Thanks so much, Tatiana. Thanks, everybody.
Thank you. Bye, everyone.
Bye-bye.